Hello everyone and welcome to the medical English lesson. My name is Dasha and I help people to learn medical English in our online school Sechenov Universkill. Today's video will be about first aid and we'll learn some new vocabulary on this topic. But first of all, we need to say what is an emergency. Emergency is a serious or dangerous situation, and always this situation requires immediate or even urgent action. And we need some urgent actions just to avoid worsening of this scenario. And what situation can be called an emergency? So, a situation is considered to be an emergency if it poses an immediate threat to life, property, health, or the environment. And here are some medical emergencies. So it can be bleeding, for example, or asthma attack, or epileptic seizure, or even heart attack, and so on. The next term, which is related to the topic of the emergency, is emergency code. And emergency codes are used by hospitals to quickly alert the staff to different emergencies. And also, emergency codes help not to cause panic or stress in visitors of the hospital, for example. The next thing is ambulance, and the ambulance is a vehicle which is used to transport sick or injured people with medical needs. And of course, you could hear the phrase call the ambulance, please, for example, in some films or series and so on. First aid. So, what is first aid? First aid is a basic medical treatment, and this basic medical treatment is given to someone as soon as possible after they have been hurt in an accident or if they suddenly become ill. So also we can say that first aid is an emergency medical treatment which is given to someone who is injured or ill. First aid kit. What is first aid kit? It's a special collection of equipment and some supplies, useful supplies, for use in giving first aid. And here we can see what a basic first aid kit may contain. They may be some plasters, small, medium, and large, sterile gauze dressings. At least there can be 2 sterile eye dressings, triangular bandages, crepe-rolled bandages, some safety pins, tweezers, disposable sterile gloves, scissors, alcohol-free cleansing wipes, some sticky tape, thermometer, and preferably it should be digital thermometer. Also, there can be skin rash cream, such as hydrocortisone, for example, and it's really useful to have a hydrocortisone ointment in your first aid kit. Some cream or spray to relieve insect bites and stings. Also, antiseptic cream is really useful, and some painkillers such as paracetamol or aspirin or ibuprofen, for example, and antihistamine tablets or maybe antihistamine cream, and of course, eye wash and eye bath. And I suppose that you need to know some terms, some common accidents and emergencies. Okay, the first one is anaphylaxis, and anaphylaxis is a really severe and potentially life-threatening allergic reaction. The next are burns and scalds, and these are damages to the skin which are caused by heat. Chemical burns are tissue damages, and these damages are caused by strong acids or maybe drain cleaners or some gasoline, and there are a lot of stuff which can cause chemical burns. Drowning is the process of experiencing respiratory impairment from submersion, for example, in liquid, or an immersion in liquid. Electric shock. Electric shock, usually domestic, occurs when a person comes into contact with an electrical energy source. Fracture. Fracture is a break in the continuity of a bone, as you can see. Heart attack. Heart attack is a severe situation which occurs when the supply of the blood to the heart is suddenly blocked by something. Shock. Shock is an acute medical condition, and this medical condition is also usually associated with a fall in the blood pressure. The next thing is stroke. Stroke usually occurs when something blocks blood supply to part of the brain, or it can occur if a blood vessel in the brain bursts. Also, we need to know some more terms. For example, cardiopulmonary resuscitation, or it is called CPR, and CPR is a life-saving technique which involves compressing the chest to assist blood circulation and also blowing air into the mouth. So why do we need to blow air? Just to deliver oxygen to the patient. And here you can see some steps of the first aid. So you see, call emergency number, check vital signs, check breathing, give rescue breath, and perform CPR. So cardiopulmonary resuscitation is performed. Well, you really need to use this verb to perform with the CPR. Defibrillator, or AED, or automatic external defibrillator. It's a special device, and this device delivers some controlled electric shock across the heart in an attempt to reset it, and get it beating on its own again. So it helps the heart to beat again on its own. CPR face mask in bag. So this is first aid supply term, and CPR face mask is used as a personal protection when someone is performing a resuscitation on an injured patient, and it helps to provide airway management as well as assist in the safe application of CPR. Thermal blanket is the last term for today, and thermal blanket is an emergency blanket, and it helps to provide some warmth by retaining body heat. This thermal blanket can be used too as a shelter or waterproof barrier or windproof barrier, and of course it can protect or can be a protection for anyone who suffers from hypothermia or shock, for example. So thank you for attention. Learn medical English with pleasure.